Hey, stop what you're doing right now, because what I'm about to share with you could be the most important thing you watch all year. Your doctor may be handing you a prescription that, without realizing it, is quietly accelerating memory loss, confusion, and cognitive decline. I'm not talking about rare side effects buried in tiny print. I'm talking about medications that millions of seniors take every single day. Medications that researchers are now linking to a measurable, documented increase in dementia risk. A landmark study published by the University of Washington, tracking over 300,000 patients across a decade, found that certain commonly prescribed drugs increase the risk of developing Alzheimer's disease by as much as 54%. 54%. That's not a rounding error. That's not a coincidence. That's a pattern. And today, we're going to talk about it openly, honestly, and without the filter that sometimes comes between you and the truth. I'm Dr. William Lee, and before we dive in, I want to ask you something personal. How old are you, and have you or someone you love ever noticed a change in memory or clarity that you couldn't quite explain? Leave your answer in the comments below. I read every single one of them, personally, because your stories matter to me. And if you've never subscribed to this channel, right now is the time, because what we discuss here could genuinely change the trajectory of your health. Now, I want to tease something before we get into the list. The number one medication on today's countdown is something so universally trusted, so completely normalized in senior care, that when I first reviewed the research, I had to read it 3 times. It's in the medicine cabinet of nearly 70% of adults over 65. We're going to get there, but first, let's start the countdown. We're going from 9 to 1, ranked from concerning to absolutely critical. Let's begin. Coming in at number 9, and this one shocks most people, we're talking about proton pump inhibitors, or PPIs, which are the drugs most commonly sold under names like omeprazole or Prilosec. These are the little purple pills tens of millions of people take for acid reflux and heartburn. They seem harmless. They're sold over the counter. But here's what the pharmaceutical companies aren't putting on the front of the box. A study from JAMA Neurology, looking at data from over 5,700 participants, found that long-term PPI users had a 44% higher risk of developing dementia compared to those who didn't use them. The mechanism is more insidious than you'd expect. Your brain runs on a fuel called vitamin B12. Think of B12 like the electricity that powers your cognitive wiring. PPIs interfere with your stomach's ability to absorb B12 from food, effectively cutting power to the grid. After age 65, your stomach already produces 40% less intrinsic factor, the protein that helps absorb B12. Add a PPI on top of that, and you're essentially dimming the lights in your brain month after month. If you're on a PPI, talk to your doctor about monitoring your B12 levels every 6 months. If you do need to supplement, take methylcobalamin rather than cyanocobalamin, as it's the form most readily used by aging brains. Pair it with folate and vitamin B6 for a synergistic effect that supports neurological function. And start asking whether you truly need the PPI long-term, or whether lifestyle modifications could give you relief instead. Stay tuned, because number 8 is something that almost every person over 60 has been handed at some point. Number 8 on our list is antihistamines, specifically the first-generation variety. We're talking about diphenhydramine, the active ingredient in Benadryl, Tylenol PM, ZzzQuil, and dozens of other over-the-counter products. People use these for allergies, for sleep, for colds. They feel gentle. They feel old-fashioned, almost nostalgic. But the science tells a deeply alarming story. Researchers at the University of California, San Diego followed 3,500 older adults and found that those who used anticholinergic drugs, the class to which diphenhydramine belongs, for more than 3 years had a 54% increased risk of dementia. The word anticholinergic means that these drugs block acetylcholine, which is the primary neurotransmitter responsible for memory and learning. Think of acetylcholine like the postal service of your brain. It carries messages from one neuron to another. Block those mail trucks, and the messages stop arriving. Do it long enough, and the postal routes start deteriorating permanently. After the age of 70, your brain's ability to produce acetylcholine naturally drops by nearly 30%. These medications accelerate that decline in ways that may not be reversible. If you need something for sleep, talk to your physician about melatonin, low-dose magnesium glycinate, or cognitive behavioral therapy for insomnia, which has been shown to outperform medication for long-term results. If allergies are the issue, newer generation antihistamines like cetirizine or loratadine do not cross the blood-brain barrier the way diphenhydramine does. And before I move to number 7, I want to tell you about a patient I'll call Margaret. She was 72 years old, from Savannah, Georgia, sharp as a tack her entire life, a retired school principal who did the crossword every morning. Her family started noticing she was repeating herself, forgetting names, losing her train of thought mid-sentence. Her doctor almost put her on an Alzheimer's medication. But when we reviewed her full supplement and medication list, we found she'd been taking Tylenol PM every single night for 4 years. We eliminated it, added magnesium glycinate and a sleep hygiene routine, and within 90 days, her family said they had their mother back. That brings us to number 7, and this one lives in the bathroom cabinets of millions of older adults managing bladder issues. We're talking about anticholinergic bladder medications, drugs like oxybutynin, which is sold under the brand name Ditropan, and tolterodine, sold as Detrol. These are prescribed for what's called overactive bladder, a condition that affects roughly 33% of adults over 65. A study from the University of Nottingham, published in the British Medical Journal, analyzed nearly 300,000 patients and found that those with the highest exposure to strong anticholinergic medications had a 50% increased risk of developing dementia. And here's the part your prescribing physician may not have had time to explain to you. Many of these drugs were originally developed with younger adults in mind. In an aging body, the blood-brain barrier, which is the protective shield around your brain that prevents harmful substances from entering, becomes more permeable. After age 75, it's like going from a solid wall to a chain-link fence. These medications slip through more easily, and they accumulate in the brain tissue in ways they simply don't in a 40-year-old. If bladder control is a concern, there are alternatives worth exploring. Pelvic floor physical therapy has shown remarkable results in clinical trials, reducing urgency episodes by up to 70% in some studies. Beta-3 agonist medications like mirabegron work differently and do not carry the same anticholinergic burden. The point is, you have options. Number 6 is one that many people are surprised to find on this list because it's almost universally seen as a heart health win. Number 6 is statins. Now, I need you to hear me carefully here, because I am not telling you to stop your statin medication. For people with documented cardiovascular disease, the benefits of statins can absolutely outweigh the risks. But I am telling you that the cognitive side effects of statins are real, documented, and frequently underreported by the medical system. Statins work by reducing your liver's production of cholesterol. But here's what most people don't know. Your brain is made of nearly 25% cholesterol. Cholesterol isn't just a villain. It is a fundamental building block of every neuron you have. It's the material your brain uses to build myelin, which is the insulation coating around nerve fibers that allows signals to travel quickly and accurately. Think of myelin like the rubber coating around electrical wires. Strip it away, and the signal degrades. Statins, particularly fat-soluble ones like simvastatin and lovastatin, cross the blood-brain barrier and can reduce the cholesterol your brain needs to function optimally. Research from the University of California, San Diego's Statin Effects Study found that over 75% of patients who reported cognitive side effects saw improvement after stopping the statin within a median of just 30 days. The FDA updated statin labeling in 2012 to include a warning about memory loss and confusion, yet this is rarely communicated proactively to patients. If you're on a statin and have noticed brain fog, memory lapses, or word-finding difficulties, have a candid conversation with your cardiologist. Ask about hydrophilic statins like pravastatin or rosuvastatin, which are less likely to penetrate brain tissue. And if you do stay on a statin, supplementing with CoQ10, which statins also deplete, may help support mitochondrial function in the brain. Number 5 will genuinely surprise you because it's something many seniors have been told is protective. Number 5 is benzodiazepines, the class of drugs that includes medications like diazepam, which you may know as Valium, lorazepam, sold as Ativan, and alprazolam, sold as Xanax. These are prescribed for anxiety, for sleep, for muscle tension, and for alcohol withdrawal. In the short term, they work, but the long-term story is one of the most compelling and disturbing in all of geriatric medicine. A massive study published in the British Medical Journal, drawing on data from over 1,700 Alzheimer's patients and 7,000 control subjects, found that people who had used benzodiazepines for more than 3 months had a 51% increased risk of Alzheimer's disease. Those who used them for 6 months or more had a risk that climbed to 84% higher than non-users. Let me repeat that, 84%. Benzodiazepines work by enhancing the effect of GABA, which is the brain's primary inhibitory neurotransmitter. Think of GABA like a dimmer switch on your nervous system. Benzo drugs turn that dimmer all the way down. In older adults, this suppresses not just anxiety, but also the neurological processes essential to forming new memories and consolidating long-term cognitive function. After age 65, your brain metabolizes these drugs up to 50% more slowly than a younger person's brain, meaning the drug lingers, accumulates, and disrupts cognition far longer than intended. If you've been on a benzodiazepine for more than 4 weeks, please do not stop abruptly. That can be dangerous. But do have a serious, documented conversation with your physician about a supervised taper. There are non-pharmacological alternatives for anxiety, including mindfulness-based stress reduction, which a study at Johns Hopkins found reduces anxiety symptoms comparably to medication without any cognitive cost. We are now at the midpoint of this list, and if you've been finding this information valuable, this is the moment I'm going to ask you to hit that subscribe button and leave a like below this video. These videos take enormous research and effort to produce, and your support is genuinely what keeps them coming. Now let's go deeper, because we're entering the top 4, and the risk levels climb significantly. Number 4 is tricyclic antidepressants. These are older antidepressants like amitriptyline, nortriptyline, and doxepin. They're prescribed not just for depression, but also for nerve pain, migraines, and insomnia. They were popular before newer antidepressants were developed, and many seniors have been on them for decades. Research from the Indiana University School of Medicine used PET brain imaging to study 451 older adults and found a direct correlation between the use of anticholinergic medications, including tricyclic antidepressants, and visible brain atrophy, reduced brain glucose metabolism, and lower cognitive performance scores. These aren't abstract statistical risks. This is physical evidence of brain shrinkage visible on a scan. I had another patient I'll call Robert, 78 years old, from Portland, Oregon, a retired engineer who prided himself on his meticulous thinking. He'd been on amitriptyline for 15 years, originally prescribed for chronic back pain. His family brought him to me worried about dementia. His scores on cognitive assessments were borderline. We worked with his pain management physician to transition him to a non-anticholinergic pain protocol involving low-dose naltrexone and certain targeted supplements. Within 6 months, his cognitive testing scores had improved by nearly 30%. He called me and said, "I feel like the fog lifted." If you are on a tricyclic antidepressant, there are modern alternatives with far lower anticholinergic burden. SSRIs and SNRIs are generally considered safer for older adults cognitively. Ask your doctor about the transition. You deserve that conversation. Number 3 is something that often lives quietly in the medicine cabinet, taken casually and regularly without much thought. We're talking about sleep medications, specifically the class known as Z drugs, which includes zolpidem, sold as Ambien, esopicolone, sold as Lunesta, and Zaloplan, sold as Sonata. These are among the most commonly prescribed medications in adults over 65, and the cognitive implications have been mounting in the scientific literature for years. A study published in the British medical journal Open, tracking over 3,000 elderly patients, found that current and former users of Z drugs had a 43% increased risk of dementia. But here's the mechanism that makes this particularly sobering. Sleep is not just rest. It is the brain's maintenance window. During deep sleep, your glymphatic system, which acts like a lymphatic drainage system specifically for the brain, flushes out toxic waste proteins, including amyloid beta, which is the very protein that builds up into the plaques associated with Alzheimer's disease. Think of the glymphatic system like a cleaning crew that comes in every night to mop the floors of your brain. Z-drugs alter your sleep architecture so profoundly that they suppress the deep sleep stages during which this cleaning occurs. You may feel like you slept, but your brain never got cleaned. After age 70, your natural deep sleep production already declines by as much as 75% compared to younger years. Adding a Z-drug suppresses what little remains. Over years and decades, the waste accumulates, the plaques build up, the cognitive decline accelerates. Safe, proven alternatives exist. Magnesium L-threonate specifically has been shown by researchers at MIT to cross the blood-brain barrier and improve sleep architecture. Cognitive behavioral therapy for insomnia has a success rate comparable to medication with zero cognitive side effects. Low-dose melatonin between 0.5 and 1 milligram has been shown to help reset circadian rhythm in older adults without the neurological suppression. Scientific references for all of these studies are linked in the description below. Now we're down to the top 2, and I promised you early on that the number 1 item on this list would stop you cold. Before I get there, we have number 2, which carries its own devastating profile. Number 2 on our list is anticholinergic antipsychotics, particularly when prescribed off-label to seniors for sleep or agitation. Drugs like quetiapine, sold as Seroquel, haloperidol, and olanzapine are powerful psychiatric medications increasingly being used in nursing homes and assisted living facilities to manage behavioral symptoms in elderly patients, often without full informed consent from the patient or family. The FDA issued a black box warning on these medications, specifically stating that elderly patients with dementia-related psychosis treated with antipsychotic drugs are at an increased risk of death. But beyond mortality, the cognitive damage done in those who survive long-term exposure is staggering. Research from Karolinska Institute in Sweden, following over 70,000 dementia patients, found that antipsychotic use was associated with a significantly accelerated rate of cognitive decline, faster disease progression, and greater loss of functional independence. These drugs work by blocking dopamine receptors in the brain. Dopamine is not just the feel-good chemical. It is critical to attention, decision-making, motivation, and memory consolidation. Block dopamine receptors in an aging brain, and you are essentially unplugging the very circuits needed for cognition to remain intact. If you have a loved one in a care facility who has been placed on an antipsychotic medication, ask for a full medication review. Ask specifically whether the drug is being used for a documented psychiatric diagnosis or for behavioral management convenience. You have the right to that information, and you have the right to request non-pharmacological behavioral interventions as alternatives. And now we've arrived. Number 1. The medication I told you at the very beginning that would surprise you, that lives in the medicine cabinets of nearly 70% of adults over 65. Are you ready? Number 1 is combination anticholinergic drug burden, and the specific culprit at the center of it is something called polypharmacy, combined with drugs like urinary antispasmodics, certain antihistamines, antidepressants, and most critically, drugs like hyoscine and scopolamine, which are prescribed for nausea, motion sickness, and dizziness. Products like Transderm Scop, Donatel, and various over-the-counter nausea remedies carry hyoscine as their active ingredient. But the number 1 danger is not any single drug in isolation. It is the cumulative anticholinergic burden of taking multiple medications simultaneously. Research from the Alzheimer's Research and Prevention Foundation, combined with data from the Mayo Clinic, demonstrated that adults over 65 who are on 5 or more medications simultaneously, which describes the majority of seniors in America today, face a 300% increased risk of adverse drug reactions, including severe and sometimes irreversible cognitive decline. A study specifically measuring what researchers call the Anticholinergic Cognitive Burden Scale found that patients with the highest cumulative anticholinergic scores were 3 times more likely to develop dementia within 10 years than those with low scores. Here is the brutal reality that the healthcare system rarely communicates clearly to seniors or their families. When you see your cardiologist, they prescribe for your heart. When you see your urologist, they prescribe for your bladder. When you see your orthopedist, they prescribe for your pain. When you see your psychiatrist, they prescribe for your mood. No single physician is looking at the total picture, the full chemical landscape inside your body, and calculating the combined cognitive burden you are carrying. That is how a 73-year-old woman ends up on 7 medications, none of which individually seems dangerous, but together are quietly dismantling the architecture of her mind. The solution is to request what's called a comprehensive medication review, or a brown bag review, with a clinical pharmacist or a geriatrician. Bring every single medication, prescription and over-the-counter, every supplement, every vitamin, everything to one appointment and ask for a full anticholinergic burden assessment. Many hospital systems now offer this service. Ask for it by name. After age 75, your liver's ability to metabolize drugs decreases by up to 40%. Your kidney filtration rate drops significantly. Your body's water content decreases, meaning drugs concentrate at higher levels in your blood than they would in a younger person. Your brain's protective barrier becomes more permeable. Everything changes, and the prescribing protocols that were built around 40-year-olds in clinical trials often do not translate safely to a 75 or 80-year-old body. You deserve prescribing decisions that account for that reality. If you are currently on any of the medications we've discussed today, please do not panic, and please do not stop taking anything abruptly. What I'm asking you to do is become an informed, empowered advocate for your own brain health. Print out this list, bring it to your next appointment. Say to your physician, "I've been reading about anticholinergic cognitive burden, and I'd like us to review my medication list together." Those 7 words can open a conversation that might protect your memory for decades to come. Because here is what I want to leave you with. Your independence, your ability to recognize the faces of the people you love, to remember the stories of your own life, to laugh at a joke, to find your keys, to feel fully present in your own mind, that is not a small thing. That is everything. And I have seen patients in their 70s and 80s make changes to their medication profiles and get pieces of themselves back that they thought were gone forever. I have watched families get their mothers and fathers and grandparents back. It is never too late to ask better questions. It is never too late to demand better care. It is never too late to protect your most precious asset, which is not your home, not your savings, not your physical strength. It is your mind. The brain is remarkable in its capacity for resilience. Science has shown that when we remove the barriers to its function, when we stop flooding it with chemicals that block its messengers and suppress its maintenance cycles, it begins to heal. Not always completely, not always quickly, but genuinely. And that possibility belongs to you. If this video gave you something to think about, if it made you want to make one phone call or ask one question at your next doctor's visit, then it did exactly what it was meant to do. I would love for you to subscribe to this channel so that you never miss information like this, because we release new research-backed content every week specifically designed for adults who are serious about protecting their cognitive health and their vitality. And now I have a question for you in the comments. Have you or someone you love experienced a change in memory or mental clarity while on any of these medications? Tell me your story. Tell me your age, where you're from, and what you noticed. I read every comment, and your experience might be the thing that helps someone else recognize what's happening to them before it goes too far. Take care of your brain. It's the only one you have, and it is absolutely worth fighting for.